So we talked about the substance abuse in the first section of our lecture. Now let's start with the fetal malpresentation at the term. And in this section, we will talk about the breech presentation and what are some predisposing factors that can lead to breech presentation at term. So fetal malpresentation at terms, this is the diagram that shows different malpresentations that can be present at term. We have complete breech. This is the complete breech. Then we have frank breech. This is the picture of the footling. Then the transverse lie, and then the oblique lie. This is the baby with breech presentation. So complete breech is the baby with the legs flexed at the knee. Frank, legs are extended, and then footling is the condition as the name shows. The foot is the organ of presentation or structure of presentation, and foot comes the first. And transverse lie, when the lie is transverse, and oblique lie. All these are the malpresentations that can present at birth, and malpresentations is the name given to any presentation other than cephalic. If the head is coming first, that's the normal presentation. If the head is not coming first, all these are known as malpresentations. So, not cephalic. Breech presentation, oblique and transverse positions are not uncommon antenatally. So even though breech is common if it's not cephalic, the other two, transverse lie or position and then the oblique lie, also are not very uncommon. Breech presentations, these are the breech presentations. We have a frank breech. Just the legs are completely extended like this. Then we have flexed breech. The baby legs are flexed at the knee, and then the footling breech. Extended frank breech. This is the extended frank breech. Flexed complete breech. This flexed position is also known as the complete breech. And then the footling breech, when the foots are down and they are the first coming out. And then flexion, make sure you should know flexion is the position in which there is bending, and extension is when it's completely straight or straightening. In this, if you see, the position of the legs is extended and straight. Flexed is bending. So flexed breech and frank breech with legs extended. Next, what are some predisposing factors that can lead to breech presentation at term? In the maternal, we have in the causes in the mother, if there are fibroids present. Fibroids are the growths of smooth tissue which can develop during pregnancy as a result of hormone changes, and they can sometimes grow to big size. So if the fibroids are present in the mother, this can cause the difficulty in the growth of the baby and difficulty in changing the position, so it can ultimately lead to breech presentation. Congenital abnormalities of the uterus, including the abnormality in the shape of the uterus, which have bicornuate uterus, in which the two cornua of the uterus are present, and again it can limit the space and limit the mobility and movement, can lead to breech presentation. And if there is any surgery on the uterus, it can cause breech presentation also. Now, what are some factors that can lead to breech presentation in the baby? Multiple gestation. If there is more than one fetus present, if there is twins or triplets, again it can lead to breech presentation. Prematurity can lead to breech presentation. Placenta previa. Placenta previa is a condition in which the placenta is low-lying. So it is present in the lower half of the uterus, and it sometimes covers the os and the cervix. So it can cause breech presentation. Then some abnormalities of the fetus like anencephaly or hydrocephalus. Anencephaly is a condition in which the head is small, and hydrocephalus is a condition in which the head is big. Both can lead to a breech presentation at term. Fetal neuromuscular condition that can affect the movement, and movement is slow. It's hard for the baby to change the positions. It can lead to breech presentation. Oligohydramnias. Oligohydramnias is a condition in which the amniotic fluid is less, and it can cause breech presentation. And then another opposite condition to oligohydramnias is polyhydramnias, in which the amniotic fluid is excessive amount. So both can cause breech presentations due to same reason. Mobility is affected. Polyhydramnias, increased fluid, increased movement, they keep on changing the positions, and then in oligo, again it can affect the fetal mobility and cause breech presentation. So all these factors in the mother and in the fetus can cause breech presentation at term, and that can lead to complications associated with the breech presentation and the management of breech presentation. So that was all about the breech presentation and different malpresentations that can be present at birth, mostly the breech, and then we have oblique and transverse lie also. Thank you for watching sqadia.com.